So this is the dissection of the lower limb. Here we see anterior superior iliac spine, and through this is the sartorius muscle, which is going downward and medially. Right. Then here we see this is the adductor longus muscle. It is a little bit broken over here, but adductor longus is coming, and this is the triangle what we see as a femoral triangle. Inside this triangle laterally we see the two division of femoral nerve. Then we see the femoral artery and femoral vein. This is the saphenous vein, which is draining into this femoral vein and going downside. It is also broken during the dissection. So that is the femoral triangle which we see. This is the anterior superior iliac spine, and this is the pubic tubercle region, and between these two the inguinal ligament is present. That is about the femoral triangle. I can't go into the deep about the iliacus, iliopsoas, pectineus and all those muscles which are present into the floor here. Now we come down and they see that this is the vastus muscle, and this is the vastus. This is the rectus femoris, quadriceps femoris or rectus femoris. This is the vastus lateralis, intermediate and medialis. All these fours unite as quadriceps muscle. Again I am repeating, this is the rectus femoris and three vastis, lateralis, this white color intermediate, and then the medialis. All fours forms the quadriceps. This is the region where we see the adductor canal, and in this we see that this femoral vessels are coming down. Somewhere here is the fifth osteoporotic opening through which these vessels are entering into the popliteal fossa. While on medial side, this is the adductor brevis and this is the adductor magnus. Okay, now we go to the another medial side. Well, we see a very small muscle over here which is left, and this is the gracilis muscle which is coming. Longus we have seen in front, then the brevis and the magnus, and then we go to the back side. Magnus is already discussed, and here we see that these are the three muscles. One is going to the lateral side, and this is the long head of biceps femoris. The short head is just below this. This one you can see. This one is short head and this one is the long head. While these are the muscles which are coming to the medial side. Out of this is the one muscle whose lower end is tendinous. This is semitendinous. And then we see a muscle whose upper end is more fleshy. Lower end is fleshy and upper end is more flat and tendinous. This is semimembranosus. So semimembranosus on its superior side is more flat and white shape, and lower side it is as a more fleshy browny part. While semitendinous lower side we see the tendon here, while upper part is browny and more fleshy. And this is long head of biceps and short head. All these muscles forms the hamstring muscles, including the adductor magnus. Here we see that the sciatic nerve, it is this nerve which is passing, and the sciatic nerve you can see here is divided into two parts. One is the lateral going, this is common peroneal, one is the straight, that is tibial nerve. And where is the division? The division is present at the apex of popliteal fossa. So before, since this dissection has distorted the muscle a little bit, otherwise we see that this is the boundaries of popliteal fossa. This is the superior lateral, this is the superior medial, this is the gastrocnemius, so forming the inferior medial and inferior lateral boundary, and this whole is the popliteal fossa. If you go inside this popliteal fossa, the dissection in this specimen is not so well, but we can see the outside structure, that is the gastrocnemius with these two heads. This one is the medial head, this one is the lateral head. Below this, the tendon of plantaris is present, and then we see the soleal muscle. These dissections are a little bit not so well present here, you see, and all these toes gastrocnemius plantaris and soleus. This forms the triceps suri or tendo Achilles. This is the gastrocnemius. Below this is the plantaris we see, and this is the combined form of gastrocnemius and plantaris in this specimen. Now we see this is the lateral side of the leg, and this is peroneus longus, and this is the brevis, which is short below this, and these are the peroneus brevis tendon, and this is the peroneus longus tendon. So these are the lateral side. Here we also can notice this common peroneal nerve is coming. If you put the thumbs at this region, you may feel the head of the fibula, and it is the neck of fibula where we see this common peroneal nerve is passing. So this is the lateral compartment. If you go deep to the posterior compartment, you may see this tibial nerve again and the deep muscle, where you see the flexor digitorum longus and flexor hallucis longus muscle. Since they cross over here, so this lateral side is the flexor hallucis longus, while on medial side we see flexor digitorum longus. This tendon crosses over here and reach it into the sole. Coming to the front of the leg, this is the patella, and this is the ligamentum patelli is present. You can feel here the tibial tuberosity, and then these are the structure. All these key of these structures are present just in front of the ankle joint, where we see the superior band of extensor retinaculum. We see the structures over here. The first tendon is tibialis anterior. Then next one is this one, that is the extensor hallucis. In between these two, these are the deep the anterior tibial artery and the deep peroneal nerve, and then extensor digitorum longus, and then a last thread of peroneus tertius. The tibialis anterior, extensor hallucis longus, anterior tibial artery is now in below this band is converted into the dorsalis pedis artery. So you can see over here deep peroneal nerve is divided and giving all the nerves. Then we see these four tendons, 1, 2, 3, 4. All these four tendons are extensor digitorum longus, and we see an additional small tendon. This is the peroneus tertius. Remember, peroneus tertius is the part of the muscle group present in the front of the leg, while peroneus longus and brevis are part of the lateral compartment of the leg. So that is here. Here we see extensor digitorum brevis, which is present over here as a bulk, and one first bigger one of this extensor digitorum is named as extensor hallucis brevis. So extensor digitorum brevis and extensor hallucis brevis are restricted over the dorsum of the foot. If you see, go into the sole side. So we have not done a deep dissection over here, but yes, we see the first one in the middle is the plantar aponeurosis, and below this is flexor digitorum brevis muscle. While here on lateral side you may notice abductor hallucis, and on the lateral side is the abductor digiti minimi. This abductor hallucis also contain below this the flexor hallucis brevis, which is the muscle of third layer. So remember, here we do not see one single tendon. It is a mixture of first layer and the third layer tendon. In this side, if you go deep below that, you may also notice the complete flexor hallucis brevis muscle. That is the sole part. Maybe in the next video we can give you the deep dissection of the sole of foot. How does it look like? In this middle part, we may notice this medial part where the ankle joint is present. This is the bandius portion where this is the extensor retinaculum. Here we see the flexor retinaculum is present. On the dorsal side, this is the triceps suri muscle which is present, and the posterior compartment of legs muscle. This is the tendo Achilles part which is inserted onto the calcaneum. So that is about the superficial and dissection of the lower limb.